Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurvich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Okay, so for part 2 of healing the mucous membranes, we're going to finally get to the effects of cortisol and stress on the gut.
Let's talk about cortisol.
Okay.
Okay, so cortisol affects intestinal barrier integrity via the brain immune system signaling. So things I didn't know, that there are studies that show that some neuropsychiatric conditions actually disrupt the gut-brain barrier.
Like schizophrenia.
Parkinson's, autism, depression, and anxiety.
Okay, so, as of now, we think of Parkinson's as a GI-based disorder.
Yep.
Your first symptom, this is going to freak everybody out,
yeah.
10 years before you have onset of Parkinson's.
I know.
And, so now I'm like, oh, I'm constipated, I must have Parkinson's.
And, kind of to that point a little bit, they've found intestinal permeability has increased before people have frank IBD.
Mm-hmm. Right.
Mm-hmm.
So what if we heal that first?
That would be nice.
Would they get full-blown disease?
Yeah.
We don't know.
Just as an aside on that, the other thing that causes IBD is significant amounts of pharmaceutical use, especially antibiotics, and having foodborne illnesses.
Totally.
And I remember when I was reviewing some of those studies, there's also like food additives that are just in our food system, right? That have been correlated at least with IBD.
So our food system is toxic?
Food affects the potential onset of some of these conditions.
Food doesn't do
shockingly,
anything to
shockingly.
the digestive tract. I don't know what you're talking
No,
about.
food
Contrary to popular belief.
Okay, we're all rolling our eyes here for people who can't see. Okay, so a couple of studies that I thought were kind of interesting.
I'm just going to throw in there. I was telling my niece who's 7 about, I keep trying to tell her to cut down on sugar, and she's like, I wish sugar was good for me. As she dove into this cake.
Oh, sweetie.
Some of our coworkers, they had a little girl who was, I think 7 or 8, and she looked up at her mama with her date with her like eyes just like in awe, and she was like, "Mama, I just love sugar."
Yeah.
She was like, "I know, girl. Me too."
A kid with sugar, it's something else.
An adult with sugar is also something else.
Yeah. Kids are cuter. Okay, so one study, this was interesting, and this one actually does talk about colonic permeability issues, so not just the small intestine. So I'm going to just kind of like recap a little bit here. So they gave an acute stressor to people, and these were people who found public speaking to be like really stressful, obviously, and that they found, they did a study where there was colonic paracellular permeability tested, and they found that in those folks, they also had associated visceral hypersensitivity that was stimulated by the stressor. So, colonic paracellular permeability and visceral hypersensitivity were worsened with an acute stressor. They then tested people who had to do this public speaking thing, and they found that small intestinal permeability increased, and that was a lactulose mannitol urinary test. And it was only observed in subjects who mounted a cortisol response.
Oh, yeah, because that has to do with the whole issue of nervous system flexibility and being able to control your stress response, which I'm quite bad at.
Right. So if you can do that,
great. Work in progress.
For everyone else out there, and they linked it to mast cell activation.
Oh, whoa! This study has it hits all the high notes.
No, I was so excited to talk about it. So corticotropin releasing hormone, mediated by the mast cells was sort of the way that went. So in a different acute stress model using cold pain.
Oh, that sounds horrible.
Right? I know. I'm like getting intestinal
Why don't they use
permeability.
heat? I'd rather have heat,
right
like
now.
a heat shock.
Yeah.
I gotta say, as somebody who's now ending all my showers with cold, every time,
Rub it in, Alana.
every time, I hate it. I have to talk every time.
You feel better.
Afterwards, every
I
time.
know, and your energy's better throughout the day.
And my brain is better, and my
mood
sleep is better.
I know.
Every
hate
time.
it.
I hate cold.
Same.
I know, guys, woman up.
Yeah, we need to
Woman
develop
up and
some
cold emerge.
temperature
Females
flexibility.
only here, though. In a different study where they used the cold pain, and this is women only that they studied this, albumin permeability increased, which is another marker.
Yeah, actually, albumin permeability is one of our big markers for really severe inflammatory bowel
But it was
disease.
only in females.
So interesting. So are we saying that albumin? I guess it makes sense.
Alana, can you explain that? I didn't know about albumin being a marker for IBD.
So basically, the way that I think about it is if the GI is so inflamed that the albumin is quite low, that lets us know that it's like basically the inflammation is so severe. So you use albumin to see severe disease.
It's not a marker of malabsorption in that? It's both? Or?
It's both.
Okay.
Yeah, I think of it more with inflammation because the other thing that happens with these patients who have low albumin is they have bad edema.
Okay.
Because they literally can't take in the protein.
Right. Oof. Okay, so how do we treat cortisol? Like, we know it's a problem. If it's too high, how do we treat cortisol?
I know.
Beta blockers.
You go live in the woods with no social media.
No digital devices.
Yeah, and
Don't
no work.
Well, you got to talk to people.
Wait, you have
Talk
an
to the animals.
independently wealthy family.
Because money doesn't cause stress issues at all.
No. And then you buy a property and live on top of the mountain with the monks.
Great. Problem solved. Podcast over. See you later, guys. Just kidding. Okay. So with the goal of healing the gut. So more studies here. Bear with me. There is a study in mice.
Okay.
It's in mice. I have another one in humans. Feeding them a probiotic reduced the amount of stress hormone in their blood. Cool. However, when the vagus nerve was cut, the probiotic had no effect.
Why would they do that?
Because they're animals. They can't do it on... She definitely doesn't have a human study with that.
Because there are studies like IBDs that show that vagal tone is down. So in those folks, should we even give them probiotics or should we
work on their vagal tone?
Right.
Yeah.
The problem with working on vagal tone, it is all theory and virtually no practicality. There's a whole lot of hype.
I mean, I think it's more learning to figure out for that person how you can develop nervous system flexibility to regularly manage stress better is how one of the Stanford professors put it. Like, we are not going to get rid of stress. How can we manage it better? Right? Yep. Like daily exercise. I've thought about getting a punching bag, but I don't have one yet.
As somebody who did a really hard upper body workout today,
exercise.
That would make me even more tired.
So what about diaphragmatic breathing? Because I teach that to pretty much
That's
all.
great. I mean,
what do you
Huberman
know?
says, he's got the double inhale, exhale.
Can I just say that my husband refers to Huberman as my boyfriend?
Oh boy.
Because he's always whispering sweet nothings in my ear.
Yeah.
But Huberman has done, and I was actually just listening to one of his podcast interviews about how they studied stress and the response to stress with meditation, with exercise, with what did she call it? It was like abundant reality, or like basically when you're like, stress is just a part of our lives. Like there's
just
no
acceptance,
radical acceptance. That's exactly what it is.
Buddhism.
Yeah, just like radical acceptance. Stress is a part of our lives. There is nothing that we can do about it, but it's that constant rumination and the repetition of the stress that is what
being in a
causes the issue.
sympathetic state for long period, like for our whole day.
Yeah.
And lives.
Yeah. So I, as someone who like gets my hands in people's guts all the time, because I do a lot of abdominal
therapy. You might want to explain that better.
Just stick my hands in there. What do you mean? My abdominal therapy, visceral manipulation. Like I have my hands on, their gut, and I'm feeling the tension people carry around, and some are more than others, but definitely people with gut issues have like a mild guarding. Like it's kind of a hypertonic abdomen. If I can teach people how to do, I do 4-7-8 breathing, which I learned from my mentor in school, Dr. Leila Altman. People's diaphragm calms down. Like everything's a lot looser when I go in with my hands to feel it. And the small intestine feels looser too. And bloating gets better, bowel transit improves, like all sorts of things. I tell folks that like, if I can see you once every other week or so for some abdominal work, great. If you can do deep breathing, specifically the 4-7-8, you're going to get way better traction.
Can you explain 4-7-8?
Yeah. Inhale to 4, hold to 7, out to 8.
Wow.
And when people have a really tight abdomen or diaphragm specifically, which is where the vagus nerve connects, right, between the brain and the gut, you're going to have to count really fast. That 7, holding for 7 at the top of the inhale is not going to work. But you can count really quickly. And as the diaphragm relaxes and gets its full range of motion, you can slow down counting.
And then do you want to talk about Huberman's study?
He does the double inhale exhale, and anyone can Google, and he does a live demonstration. And he said the double inhale exhale was more successful in reducing overall stress within the next 24 hours or whatever the time period was than any of these other types of interventions that he studied for, I think, 5 minutes a day, doing it 5 minutes a day.
That's awesome.
But the other warning with that, and actually quite a few of these breathing techniques, is it could be quite stimulating. So you don't want to do it too close to the evening, especially something like that. I also personally...
Versus our screens.
Oh, yeah. I mean, no, not versus...
I mean, I think it's all a little relative, but...
But I don't know. I do feel like sometimes when you're years and a decade ago, I did this shamanic training, right? I went through this whole thing, and they taught us this diaphragmatic breathing, which was like very, very fast diaphragmatic breathing.
Oh, like pranayama breathing?
Oh,
Yeah.
man, I
And
can't
that
do
was
You probably
very
wanna do that before
stimulating
bed.
for me. Right. You don't always want to do these things before
That's
bed.
in the morning, I think.
Yeah.
Pranayama.
I do find box breathing is another one.
The 4-4.
I do 4-4-4-4, and
I
as you
think
relax,
though-
you go up in seconds.
Yeah, I think having the exhale be longer than the inhale, though,
That's been
helps
studied,
to
yeah.
shift you from a sympathetic to a parasympathetic state.
As somebody who just exhaled for longer than I inhaled, I feel more parasympathetic.
Amazing. It's like this stuff works. I have my patients do it before bed. Like, I
Yeah.
specifically have them do it before bed or if they wake in the night and can't sleep.
Yep.
Which
So-
never happens.
Right.
Never.
Well, it never
to
happens for
me.
me, knock on wood.
What? Really?
What?
I was
Yeah,
kidding.
I think, you know what's funny is, I mean,
I've talked to Alana about if I can
Wow.
give her a couple hours of sleep and she can give me a
Yeah.
couple hours of energy, we'd be good. to
She
go.
walked
big
in
deal.
and she was like, "Oh my god, I woke up in the middle of the night for the first time ever."
It was like the
outta
first time in
here.
years.
She was
Get
like,
outta here.
she was like,
I had
"How do
a-
you live?" And I was like,
Wow.
"How do you live with sleeping through the whole night every night?"
I'm not sure I've ever slept through the night.
I just go to bed and then I wake up and
Whoa.
it's 6
What a
or
time
5 or yeah.
How do you get all your ruminating in?
Yeah, that's.
I'm not ruminating a lot. Oh, in general, you meant?
Yeah.
Yeah.
Well, you could do it during the day or right upon awakening. Is a
It's
good time.
interesting. That's exactly what happens in the middle of the night.
I
It's,
solve all my problems.
Sometimes,
very
Rebecca, sometimes
inefficiently.
it is
but I also
right upon
make
awakening.
like
I'll have
1,000
to
new
say.
problems that don't exist.
Yep.
Yeah, very good use of our time.
There's in that book,
Why we sleep.
no, the book I told Alana about, Stop Worrying and Start Living by Dale Carnegie, a book my dad told me about that I think was written like several decades ago.
Yeah.
There's a quote about how one of the famous philosophers said, like, I spent most of my life worrying about the worst things, and he lists all these things, and 99% of them never happened.
Yeah,
Great
Jack-
advice. Great advice.
My husband's always like, "Yeah, you know why men sleep better than women? Because they don't lay there thinking about problems that
I don't
haven't
know if
happened."
that is accurate.
I don't know.
I think we're kind of taught to, but that's probably different podcasts.
I'll tell you what,
Yeah.
he definitely sleeps better than me.
Yeah.
That's a thing.
I think we're all a little hypervigilant.
Yeah.
Okay.
But
so,
it does make us highly productive in our capitalistic
That's true.
society.
And in our podcast.
Yeah.
You know?
Yeah.
Okay, I want to talk a little bit about fibers. So do we all know what FOS and GOS are? Fructooligosaccharides, galactooligosaccharides,
How about
fibers.
XOS?
That's not what I'm
Xylologos-
talking
okay.
about. But that is
I
another
do
one.
not like to use those with people, so I'll be curious.
So
to see
wait.
you
What
have
are,
found.
let's define, before we dive into what we like about them or not, should we define what they are?
Well, the one I'm specifically going to talk about is GOS, which are galactooligosaccharides, and foods that have them are legumes. You don't like legumes?
Oh, I like to give them food-based. I don't
Oh,
like
yeah,
to
yeah.
like have people take
Oh,
them
no,
as a
no.
supplement.
I'm just-
okay.
So they fall
Great.
under a category
Yeah.
called prebiotics. That's the
yeah,
most
yeah,
important
fiber.
thing. They are basically they are foods that feed the microbiome of the large intestine.
Good foods.
Just as an aside, these are the foods when we decided to wage a war on our microbiomes. One of the key fighters in killing off our microbiome and making it less diverse was taking all of the fibers and prebiotics out of food.
Out of
XOS,
grains.
FOS, GOS, all of those fall under prebiotics that feed the microbiome.
Yep. So they did a study in humans. This is going to surprise no one, exactly no one. They gave them FOS and GOS and placebo and found that salivary cortisol awakening response was significantly lower after GOS intake compared with placebo.
Wow.
Participants also showed decreased attentional vigilance to negative versus positive information after GOS.
So we just have to
compared
eat
with
more
placebo.
beans?
Yep. Yep.
Should we talk about our special bean prep when we're
I
done?
really,
We've taken it to a new level in our household.
Oh, have you?
Yeah.
Oh, boy.
I will
And
say,
there's a double or a triple
but
boil.
does he sprout?
We don't sprout, but he does a double or a
Is there
triple
a
boil
left
dump.
of
You're
these?
crazy.
This?
Oh, yeah.
Okay, wait.
There's
So
beans
let me
left.
just, I do feel like I
a
use
massive
this.
batch of beans.
I have a handout on this. I tell this so much. What I do with my beans is I usually make black beans. I soak them, dry beans. I soak them for overnight.
Yep.
And then I dump them. And then I water.
You dump the water.
I dump the water. I water, like I wet and I dump out the water to basically moisten them for 2 days until they sprout.
Yep.
And then after they sprout, I put them in the pressure cooker with a bunch of herbs and I pressure cook for 45 minutes. And then I put them in jars and I freeze them. That's how I make my beans, and nobody ever has gas for my beans.
I have had patients that told me they still couldn't tolerate them, but I feel this method works for most people. Ours is slightly different.
Okay, go.
The beans are soaked overnight. The water is dumped in a colander, well rinsed, boiled once, dumped again, well rinsed, boiled again, well rinsed, then put in the Instant Pot.
Like just to boiling? You just bring it to boiling?
For 5 minutes, sorry.
Okay.
Five minutes at a boil. I believe it removes some of these indigestible byproducts that give people digestive distress.
Do you have a way of making beans, or are me and
Yeah.
Emmy just okay?
No,
go.
No, but this
have
is
a
in
way.
India. They never just like eat beans. They always pressure cook them and do some
That's
method.
amazing. So my method is I buy a can from the grocery store
And eat it out of the
eat
can.
it.
Wait.
But I do find Garden of Eden. I think they put some seaweed in theirs.
They actually do I think
Okay.
they pressure cook it.
Okay, so the
at
brand
least-
Garden of Eden is my preferred choice.
I believe they at least pressure
Wait.
cook
They
it.
don't
But
bother me.
Can we just stop?
I prefer to buy it too, Rebecca.
You can like make beans.
I'm sorry. I have a baby. What can I say?
I'm just so
She doesn't
confused.
have
I'm like,
time.
I didn't know anybody could do that with a bean. Like if a bean isn't a production.
I can't sleep, but I can eat beans. Okay,
well,
so
maybe that's why
other-
you can't sleep.
Maybe
Because of the
yeah,
kind of beans.
I'm just
Maybe.
tooting all night. Okay, other forms of GOS: cashews and pistachios, hummus, which is beans, soy milk, which is beans but made from whole soybeans, and oat milk. I didn't know that one.
Great.
Okay, so another interesting thing that kind of goes in the wrong direction, but people whose IBS symptoms improved with low FODMAP, which kind of excludes a lot of these, introduced to these foods, 2/3 of their symptoms resumed. So, like, they stayed on a low FODMAP diet, but they brought back in GOS foods, the ones I just listed, and 2/3 of people, their symptoms came back.
So they could do the Nerva app, which has almost equivalent results
Yeah.
to removing FODMAPs, and then they don't have to
Yeah.
remove all these healthy
Totally.
foods.
Yeah.
I also will say I'm anti-removing FODMAPs generally.
Yeah,
me
I have never I don't think I have ever recommended removing FODMAPs. I never felt like it was a good idea.
I went through a whole stage where I recommended removing when FODMAPs were like the biggest
Yeah.
thing.
Yep.
I think it did create a whole lot of eating disorders.
Totally. It works. It works to curb symptoms, but, like, why? Like, those are good fibers for your microbiome.
And also, it
And they're delicious.
only curbs symptoms when you discontinue it. It's not treating any underlying causes.
Exactly. But I've even seen a lot of conventional gastros put people on it for years. And they come in eating like carrots and chicken.
5
That's
foods.
it.
Yeah.
Yeah. Okay, so other supplements, if we're targeting cortisol here, other supplements that I give, omega-3s. They increase good bacteria in the gut. We know that too. Fiber. I like psyllium husk. I know I've talked about that before, but that's one of my
I
all-time
like oat
faves.
bran,
Awesome.
flax, and
I like
chia.
that too.
I
Yep.
love chia. And
Yeah.
now I'm making overnight oats every Monday night. I have to make it tonight. Making overnight oats, and that is like...
Okay, here's my question, because I find overnight oats to be disgusting.
What?
Really?
Yeah, they're just slimy, sludgy.
What are you putting in it?
Do you heat it up after?
No.
Do
You
eat it
can,
cold?
if you
Oh
want.
my God, it's so good. So what I do is I use rolled oats. I try to use steel cup, but I
Yeah.
got too much kickback from my kids.
Okay.
So I use
Too crunchy?
I think it's just a different
I don't
texture
think you
than
can
they're
do
used to.
overnight oats with
You
steel.
can.
Really?
Yeah, you can. Yep. You just need more liquid.
Okay.
So I use rolled oats.
Yep.
I use chia.
Yep.
I use oat milk. I use a little bit of salt and a little bit of maple syrup. And sometimes I'll add cardamom. Oh my God, cardamom's like
That's
the
amazing.
best. It's like the best.
Yeah.
And then I just sit in the fridge overnight, and then we eat it, and it's like, and then the thing about overnight oats is it's like that's like the carrier
Yeah.
for the yogurt or the peanut butter or the
Okay.
cocoa nibs
Yep.
or the blueberries or the
Yeah.
raisins or. It's like the best.
Sounds
My
great.
mouth is watering.
You could heat it up, Rebecca. I do that sometimes.
Okay, just pop it in the microwave.
Yeah, I like to eat
I'm a
In
naturopath.
Ayurveda, they say not to eat cold foods, Alana.
I'm a naturopath. I don't believe in microwaves.
Okay, probiotics, prebiotics, okay, I don't know. Jury's out on that. HPA axis support, though, I wanted to talk about a couple of these herbs that I use a lot in my gut patients. So ashwagandha, rhodiola, tulsi, lavender, vitex.
Okay, can I just tell you a really cool ashwagandha study?
Yep.
This ashwagandha study, it was not a big study, I think like 40-something patients, and they gave them ashwagandha. They did a baseline stress and blood cortisol.
Yep.
They gave them ashwagandha, and then they retested their blood cortisol, and they gave them a follow-up questionnaire about their somatization of stress.
Yeah.
And ashwagandha not only improved their somatization of stress or their perception of stress, but also decreased their cortisol.
Cool. I mean, yeah, I see it really work.
Yeah, me too.
I see it work best as a tincture.
Oh, interesting.
I wonder, because I have not gotten great results with it, so maybe I should have patients try the tincture.
How high are you dosing it if you're doing a capsule?
I'm just doing standard dosing.
So the study that I looked at was 600 mil. So 2 capsules
Never
once a
trust
day.
a bottle. Never trust a bottle.
The dosing that in that study that I was talking about, I think was 600 milligrams twice a day.
Yeah.
I mean, but it is an adaptogen, so it should be fine whether they're hyper or hypo, right?
Yes, and
So-
I also think it's an adaptogen, which means you want to use it when you need to adapt. It's not
Right.
like an on the daily.
Sure.
I dose it, like if I'm doing a pill, which is rare, it's just if I'm avoiding alcohol, because I don't
Yeah.
really see glycerites work in adults that well for most plants.
But for ashwagandha, you do?
ashwagandha as a tincture, an alcohol extraction.
An alcohol, okay.
But if I'm doing a pill, because people prefer that, I've seen ashwagandha gummies work, which is weird for people who have to chew things.
Yeah.
And then I start at 400 if I'm doing a pill.
I've seen the proprietary product we've discussed that everyone knows about
Yeah.
for cortisol that has ashwagandha in it work well, but I have not seen it by itself, so perhaps I haven't been giving the right product.
Well,
Or the right
paired
dose.
with
Or the right person.
L-theanine-
Or the right dose.
Yeah, I think it's dose. Theanine is another one of my all-time faves for
So
cortisol.
theanine is interesting because it's a GABAergic amino acid that does cross the blood-brain barrier, right?
It
Well,
must.
I think it does.
it's supposed to, as opposed to GABA, right?
Yeah, exactly. That's why I use theanine over GABA.
Yeah.
And that, I think that from my latest look, therapeutic dose is somewhere between 200 to 600 milligrams.
And it is in green tea.
Yeah, but that's going to give you a different problem. I don't think it's GABAergic and green. I mean,
No, theanine, right?
It's an
Is in
extract
green tea?
from the green tea plant.
Yeah.
Yeah. Yeah. I start with 100 to 200 once or twice a day, depending. And that usually works just fine. But back to our talk about sleep, for rumination at night, it's my absolute favorite.
Theanine?
And it's safe in pregnancy.
oh, yeah,
good to
that's
know.
great.
Yeah, I give it a lot for that.
And lavender, I believe, has some studies that, again, one of the proprietary blends, they've compared it to a low-dose benzo, right?
Okay, so let me talk about that study because that
Yeah.
study is one of my favorites. So basically, this was a clinical trial that was done in humans, and what they did
Europe?
no, I
No,
think actually
here?
in the U.S.
Okay.
Yeah, what they did is they gave them lavender or a benzodiazepine, and they asked them for their
And this is food grade lavender essential oil.
yes, exactly
Enteric
In
coated.
gel caps.
in gel caps, yeah. And what they noticed is based on this data of subjective association with stress, it was equal to efficacy to benzo. However, what is the number one side effect of lavender?
Lavender burps.
Lavender burps.
I call them unicorn burps.
They do make me happy. However, there's no way that was a blinded study. It just wasn't.
Yeah, for sure.
Like they're saying it was a blinded study,
Yeah.
and they're saying it's enteric coated,
Unless
but
they put lavender in, but then it's not.
then it's not a double blind.
study.
You know what I mean?
Yeah.
Like there's just no way.
Yeah.
And do I see it work? I see it work for some people. I love
Yeah.
the burps. It doesn't do anything for me.
I see it work really well when paired with rhodiola.
Okay, let's talk about rhodiola. Because the way that I was always taught to when would you pull, we've got so many amazing adaptogens.
Yeah.
When would you pull rhodiola? Rhodiola is Siberian ginseng.
Yep.
The way that I was always taught to use rhodiola is, are you living, in Siberia, it is cold, it is rocky, there is no plantation, it is hard effing living. And this plant thrives there.
Yeah.
Is your life hard? Mm-hmm. Hard.
So this is the energetics.
That's the energetics
For
of
rhodiola, as opposed
I
to-
never learned it that way.
Oh,
Yeah, I learned it as like a slightly stimulating but more energizing adaptogen.
Do you both use Eleutherococcus?
I love
ginseng?
eleuthero.
Yeah.
I learned that
That works well
one-
in the tincture as
I
well.
see that one a little stimulating.
That
for
is
people.
stimulating.
Yeah, I
but
use it in the morning.
if you're like
But
struggling,
But I see it
Could
as
be-
like if I'm at all worried about like depletion, like these folks
It's
are a little
over.
bit depleted, it's revving a little too hard. I
Okay.
use rhodiola in those cases.
gotcha.
Yep.
Is that what you do?
I'm going to use ashwagandha first.
Yeah.
I'm going to use lavender. I'm going to use rhodiola. Or I'm going to use a mixed blend.
I tend to use the mixed blends for whatever reason. They seem to work. The pre-made, I'm not putting them together. They're already in the product.
Someone else did the work.
Yeah, they seem to, at least the ones that I've tried with people, I've had better luck than just one or the other. And at the recent conference we talked about, they talked about that, how just we get more bang for our buck if there's some in this type of a formulation, not necessarily when we're treating a microbe per se or whatever, but when we're trying to do adaptogenic blends, they've generally worked better than giving people single herbs.
Yeah, I think I like the single herbs better. Occasionally I'll blend one or two, but and then tyrosine is the only one I have left. Do you guys use that?
Okay, I use that a lot. That is very stimulating. That is going to push so basically if you're looking at the pathway, right, you start with phenylalanine. Phenylalanine can go to PEA or it can go to tyrosine. Yep. Tyrosine will then drop to dopamine and then it'll drop to epi and norepinephrine. So it really goes to your adrenaline producing herbs.
Yeah.
So that one, I think I only use it in the morning and at lunch,
right,
and it is more of a stimulant. Do I love it? Yes. Do I love living off of my adrenals and making my own world
Feels
crazy?
Good.
Yes.
Pair it with an espresso, you are good to go.
Unfortunately, espresso crosses the line between functional and crazy for me.
Yeah.
It occasionally gives people headaches because of the neurotransmitter pathway, but if it doesn't, I have seen it help people. I would say it's 50-50 when I've tried it with someone.
I see it really help in a very specific population.
Yeah.
And it's when cortisol is a problem with hormones. So for folks in menopause, for folks pregnancy postpartum.
And it can help with thyroid, so that would make sense.
Yeah, and cyclical cortisol issues, like if it's related to periods.
I find that when they have run off of their adrenals forever and they're starting to fatigue out or burn out, then I will put it back in and it really helps them get back online. That's when I use it.
Awesome. Yeah. So.
And that I'm dosing, somewhere 500 to 1,000 milligrams in the morning and with lunch. Yeah. Sometimes I'll go a little bit higher, but not often.
And I will say when someone is under a huge amount of stress from work, family, etc., you can give them all of these and nothing works. And then they change jobs, or I just am thinking of a patient I have literally night and day from one visit to the next with the new job, and we literally were trying this stuff for like 6 to 12 months. Nothing would budge.
That is super important because sometimes stress is because of the brain and sometimes stress is because of the environment.
Situational.
And really it's important not to downplay environmental stress to the brain.
Right.
Like some environments are toxic.
Yep.
And there's no supplement really or drug.
There was nothing that was going to work until
and some stress is from the gut.
Yeah.
For sure.
And just a reminder, 10% of nerves go from the brain to the gut and 90% of nerves go from the gut to the brain.
Yep.
So when we're talking about our brain, we really are talking about more about the brain and the GI and less about the brain and the head.
Totally. So fix the gut. Should we recap?
Okay, that was a great discussion about how cortisol affects the brain and the GI. Yeah. I learned so much. Let me tell you what I learned and then we'll go from there. What I learned is cortisol really affects the intestinal permeability in the lumen. And when you're thinking about treating the GI, you need to think about all of the stuff we talked about last episode, but really you need to think about adaptogenic herbs, stress response. And the way you do that, we talked about ashwagandha, we talked about lavender, we talked about theanine and tyrosine.
Right. So there's there's multiple adaptogenic herbs that you can try, and many of them work great depending on the person. And then we talked about how if there's a situational stressor, we just want to try to ask everyone about what is going on. Like sometimes you just know something else is going on with someone and it's just not going to shift until you get there. We can still keep trying all of this, but if you're running into resistance, that could be part of it. Otherwise, these do tend to work well as adaptogens.
For example, if you're putting yourself in cold water every day and causing intestinal permeability.
Temporarily.
Just kidding. If you're female. And also fiber. Like
fiber. Eat fiber.
Or fix whatever problems you have in your gut with...
Not some. A lot.
Yeah.
Eat a lot of fiber.
Yeah. And if you have SIBO or whatever and you can't eat fiber because of that, get that fixed.
Right. Then you should be able to eat fiber.
See one of us or someone, who can treat this, and then eat your fiber because it really matters. We have good studies on it as if we needed them.
Great.
Anything else?
Thanks, guys, for joining us. That was a great episode. Please don't forget to rate and review us. It makes all of the difference.
Yeah.
Thanks so much.
Thanks for tuning in.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.
Eee!